If you're not familiar with CLL Society's Expert Access Program, please stay tuned because Patricia Kaufman, co-founder and communication director of the CLL Society, will be sharing information about all the CLL Society's resources, including this program, our Test Before Treat campaign, CLL Society support groups, and more. I'm now happy to welcome my co-founder and caregiver, Patricia Kaufman.
Services of the CLL Society. Test Before Treat. Hi, everyone. I'm Patricia Kaufman, the co-founder and communications director of the CLL Society, and I'm here today to tell you about CLL Society's Test Before Treat campaign. As explained in our webinar, The Right Tests at the Right Time, predictive and prognostic testing are critical before choosing any therapy for your CLL. Your life may depend on getting the appropriate testing before treatment, as these tests will determine which therapies will work and which therapies will not work. CLL is variable in how it behaves. It is important to understand the specific type of CLL that you have. Knowing your CLL's ability to resist certain therapies and its sensitivity to other therapies will be critical in tailoring the appropriate therapy for you. Furthermore, CLL can evolve over time, and so you do need to be retested before starting every treatment, not just the first one. Let's hear Dr. Stefan Stielgenbauer explain the crucial importance of genetic testing.
Hello, my name is Stefan Stielgenbauer. I'm a professor of medicine from Germany. I've been involved in research into the biology of chronic lymphocytic leukemia and other lymphomas and into the development of novel treatment options. Now, as always in cancer, at the beginning, a correct diagnosis is very, very important. In CLL, we can do that from the blood. We can do it by a blood smear and immunophenotyping, so characterizing the CLL cells. And only with these two tests, you can assure that CLL is the correct diagnosis. Now, when we have the diagnosis, before treatment and before every line of treatment actually, we should do another test that is really of crucial importance, and this is genetic testing. We know that there are two big parameters that determine treatment outcome and that they are therefore very important to guide treatment. The one is the immunoglobulin mutation status, or the IGHV mutation status, that can divide CLL patient population into the ones with unmutated and mutated IGHV genes. Patients with mutated IGHV genes do relatively well, even with chemoimmunotherapy, but patients with unmutated IGHV genes don't do so well and are the prime candidates also for novel treatment approaches. Now, the other big side of the coin is the genomic abnormalities and the gene mutations. And here, p53 stands out. p53 deletion is the so-called 17p deletion that should always be tested before treatment. And the mutation is the TP53 mutation. And this should also be tested always before each line of therapy. Because we know that 17p deletion or TP53 mutation are very strongly associated and predict treatment failure with chemoimmunotherapy, while there's tremendous benefit from novel agents such as ibrutinib or venetoclax. Therefore, it is of crucial importance before the institution of therapy to test these both types of parameters, IGHV mutation status, 17p deletion, and TP53 mutation, because these parameters are of key importance to assign every individual patient to the best treatment option for him. Thank you very much.
So now that we know that these are the three most important tests for determining therapy, we need to ask, are these tests always being done? No, they are not always being done. And worse, sometimes all the right testing is being done, but the results are being ignored, and the patient is receiving chemotherapy that absolutely will not work for them. Dr. Anthony Mato and others have investigated this topic. Let's hear Dr. Mato's thoughts about this, as well as his comments on CLL Society's Test Before Treat campaign.
Hi, Anthony Mato from Memorial Sloan Kettering, Director of the CLL program, here to support the CLL Society's program Test Before Treat. It is incredibly important in 2018 to have appropriate prognostic testing performed prior to first therapy for patients with CLL. Researchers have worked really hard to develop therapies that are targeted, and those targeted agents work well in certain patient populations. Right now, we're able to look at the molecular and genetic profile of patients and identify which patients would benefit from combinations like chemotherapy, which patients need a targeted agent by itself, and maybe in the near future, which patients should be treated with combinations of targeted agents. The data that provide clinicians the information needed to make that important choice is the data that's obtained from molecular and genetic prognostic testing, FISH, cytogenetics, array, next-generation sequencing. I'm here to support the campaign because I feel that in order for a clinician to make that decision, that information needs to be considered standard of care. Those recommendations are supported across the country from organizations like NCCN, IWCLL, the CLL Society through this new campaign. So I'm hoping that some of the research that we're doing has demonstrated that that's not always done in practice, but can help to inform practitioners that that should be the way of the future for patients with CLL. Thank you.
The Inform CLL 2015-2018 study confirmed that proper genetic testing in CLL is severely neglected. The CLL Society is here to inform you as to your best possible care. We hope that our materials will encourage you and empower you to ask your healthcare provider whether the appropriate testing has been or will be done. Fortunately, the CLL Society has created the Test Before Treat one-pager, which explains all of this. You can find it on our website. And here are some action items that you can take. Read our Test Before Treat one-pager. Print it out. Take it with you to your doctor appointments whenever treatment decisions are being discussed. Insist that you know your IGVH, FISH, and TP53 status before you start any therapy. IGVH usually doesn't change over time, so it does not need to be retested. Make sure that your doctor knows that certain findings, such as deletion 17p, or TP53 mutation, or unmutated IGVH, predict that chemoimmunotherapy will not work. You can easily be your own best advocate. Check to be sure your therapy is compatible with what these tests reveal. Smart patients get smart care. CLL Society, CLL-specific support groups. That's right. In isolation, we were sharing our worries with only one person. We were just talking to ourselves. We got sick of this. So CLL Society has created over 40 CLL-specific support groups across the United States and Canada. Currently, over 2,000 CLL patients and caregivers are registered to meet monthly, virtually. It would be impossible to exaggerate the benefit of being part of a group made up of fellow CLL patients and caregivers who can share their experience along their CLL journey. So please, don't spend another month alone. Sign up today. Expert access. Are you receiving the best possible care for your CLL? Introducing CLL Society's Expert Access Program. Today, CLL patients are living longer than ever. CLL treatments are better than ever. However, you may find yourself wondering whether you are receiving the best possible care for your CLL and reaping the benefits of these extraordinary recent advances. An expert second opinion can help with this. Patients often identify the need for a second opinion when it becomes time to select an initial treatment, or when they are failing their current treatment, or when they suspect they haven't received proper testing, or possibly, even more distressing, they've received completely conflicting recommendations from various doctors as to how to proceed. Data support that having access to a CLL expert provides proven survival outcomes advantages. In other words, those with a CLL expert as part of their team do better and live longer than those without this advantage. So CLL Society addresses this challenge by offering a no-cost 30-minute online HIPAA-compliant second opinion consult with a CLL expert through its Expert Access program to over 150 patients annually. We know that for many CLL patients, a second opinion is very desirable, but it may be out of reach. The patients who use expert access find themselves in this situation for a variety of reasons, including living far from a cancer center of excellence, or inadequate insurance coverage, or simply they do not have a CLL expert in their community, and there are many other reasons. In order to qualify for this service, you must have a diagnosis of CLL. You must live in the United States. You must not be presently in the care of a CLL expert. And these are the only qualifying criteria. No financial questions are asked. No demonstration of financial need is required. Upon acceptance into the program, patients complete a brief pre-consultation survey, authorize the release of their CLL medical records to be summarized for the consulting physician. And also in preparation, the patient will be helped to formulate their 3 most important concerns to discuss with a CLL expert. At the completion, you will receive a written summary of the consultation, which is prepared by the CLL expert. You can share this with your treating physician. In our recent survey of expert access participants, 99% of respondents indicated that they would recommend this service to other patients, and 74% were planning to implement at least one change following the completion of the program. In a testimonial sent to the CLL Society, an exuberant participant stated, "I went from fatalistic to hopeful in 30 minutes. If you are in need of this, please go to cllsociety.org and apply today." Some people always seem to know what's going on at the CLL Society. How do they do that? They've signed up to receive our Tuesday weekly newsletter. Come to our website and sign up. The 130,000 campaign. Chronic lymphocytic leukemia, CLL, is the most common adult blood cancer in the United States. There are approximately 178,000 patients currently living with CLL, and about 20,000 new cases are diagnosed annually. But 130,000 CLL patients are not aware of the services of the CLL Society. 130,000 CLL patients are missing out. We need your help. Don't let 130,000 CLL patients miss out. Spread the word. Smart patients get smart care.